In case of patients who are confined to the bed for a long period of time, there has to be a change in the position from time to time. This helps in preventing the blood from getting collected and in the circulation of blood. When you position a patient properly, the pressure on the different parts of the body is equally distributed. The pressure on the skin on the bony prominences is maximum and leads to pain in those areas. By frequently monitoring and changing the position of the patient, you can also minimize the risk of bed sores. Bed sores are painful infections that are caused when the patient lies on the bed for prolonged durations. Positioning of the patient is also critical while performing a procedure such as a surgery or an injection. As a hospital assistant, you must be aware of some of the common positions that ensure patient comfort. Common positions. The alignment of the patient in a particular position should ensure that patient is comfortable and is approachable for performing a procedure. You must be aware of the different positions that a patient can be placed in. Let us look at some of the common positions. Supine. In this position, the patient is lying on his or her back. This is the most common position for a patient in the inpatient ward. Prone. The patient in the prone position is lying face down. A patient is placed in this position in case a procedure is performed on the back. Sims or lateral recumbent position. In this position, the patient is lying on the side. Based on the side, it is called right lateral recumbent or RLR if the patient is lying on the right side, or left lateral recumbent or LLR if the patient is lying on the left side. Lithotomy position. This position is often used during childbirth. In this position, the patient is on their back with the hips and knees flexed and the thighs apart. Fowler's position. A person in the Fowler's position is sitting straight up or leaning slightly back. Their legs may be either straight or bent. A high Fowler's position is someone who is sitting upright. A low Fowler's position is someone whose head is only slightly elevated. Trendelenburg position. A person in the Trendelenburg position is lying supine with their head slightly lower. This position is used for some treatments and procedures such as treating patients with shock. But this position is not preferred much anymore. As a hospital assistant, you should be aware of the different position types and assist the nurse when the patient is aligned in this position. You must also ensure that the patient is comfortable and safe during the time this position has been suggested. Aligning the patient in supine position. The supine position is the most common position in which a patient is aligned. This position is used for the physical examination of the patient. Let us look at the steps involved in placing the patient in supine position. Assist the patient to lie flat on the back. Extend the legs and separate them slightly. Place a pillow under the patient's head. Cover the patient with a sheet. This is the most basic position of aligning a patient on the bed. Once you align the patient in this position, you can assist the patient to shift into any position as suggested by the doctor. Safety measures while positioning the patient. The alignment of the patient on the bed is a medical decision because it is suggested by the doctor to facilitate for the healing of a condition. In some cases, the doctor suggests a particular position for the examination of the patient or performing a procedure. Before you align a patient in a given position, inquire with the doctor or the nurse about the condition of the patient. This will help you in assisting the patient while aligning him or her in a position. Make sure that the alignment is done in the presence of a doctor or a nurse and follow the directions given by them. Do not take a decision on your own about the alignment of the patient. After aligning the patient, inform the nurse or the doctor about the length of time the patient has been in the same position. This is to ensure that the patient is moved from a specific position to prevent any undue strain on the patient. Check with the patient for any pain or discomfort and report the condition to the doctor immediately. In case the position is aligned for an examination or a procedure, ensure that the required equipment is arranged for the nurse or the doctor. Always ensure that the patient's head is supported by a pillow and is covered with sheets, unless it has been suggested by the doctor otherwise.